Hello, this is A Livelihood, and welcome. And I'm Kitaj, your host. I'm from LifeSpring Coaching, and today I have someone to speak to and to get to know whom I think you're going to be very interested in listening to. Her name is Kenney, and she has started an organization in the last few years called MITSS. That's MITSS. And we're going to talk to her about how that came about. Hello, Linda. Welcome.
Thank you for having me.
Thank you for coming. I appreciate it.
On November 18th, 1999, I was 37 years old, and I was scheduled for a right ankle replacement surgery. However, I woke up several days later not knowing what happened. I had my chest rewired and almost lost my life, and nobody talked about it for the whole 10 days I was in the hospital.
Linda later found out that the nerve block medication administered prior to her surgery was accidentally delivered to her heart. She was revived from cardiac arrest.
I felt abandoned, nobody talking to me, no emotional support, and nobody prepared me for the emotional impact this was going to have on myself and my family, and it was devastating.
I was the anesthesiologist that was involved with Linda's care on that day, and here I was, the one who basically performed the block, and it was all on my shoulders. So for me, there was just a need to acknowledge that responsibility and to step up to that.
Rick took an unusual step and wrote Linda a letter without the hospital's permission.
I was not able emotionally to even consider that until 6 months later, and then we were able to have a phone call.
It was the first time that we were able to talk about what happened, and really what made it the most powerful conversation for me was her offering me forgiveness.
I needed to forgive him for myself. My forgiving him would give me the ability to move on.
So the striking thing about it, though, especially now looking back after 10 years and after your organization, MITSS, has been doing so much to change this culture, the striking thing is that, one, you were not told the truth originally about what happened, and two, nobody was really talking to you.
Exactly.
So your doctor, who was on the video there, the anesthesiologist, Rick Van Pelt, I guess he tried to contact you.
He actually made 3 attempts while I was in the hospital to come and see me, and he was blocked.
So that was against administrative orders at the hospital.
It was administrative, it was clinical people, and my husband had said, you've done enough. I think you should. He was afraid I'd be traumatized by seeing him. So there were three strikes against him, so he stayed away, and then he ended up writing a letter a week after I was discharged from the hospital.
Right, but at that time you weren't ready to see him or respond.
No,
it took a while.
The other thing that I forgot to mention is I was discharged from the hospital with instructions on how to care for my chest and information about a visiting nurse. I had, again, this was my 20th surgery. I had many, many surgeries, day surgeries, where I would get a phone call the next day. Hi, Mrs. Kenney, how are you? What can we do for you? I almost die. I get discharged from the hospital, and I don't even get a phone call. And that leaves a taste in your mouth. I can't explain it. But me personally, I didn't want to sue. I wanted to get beyond it. I was already, I finally reached the bottom where I said, I can't, I'm done. I don't want to, how can I get out of this? So I made some decisions. I decided I was not going to sue. I decided I was going to try to reach out to that doctor. I thought, if I feel this terrible, how does he feel? If he's the one that almost injected me, I couldn't imagine living with that. And I knew that if I pursued litigation, that it would not only probably hurt him, it would also put my family through years of agony, and we were trying to get to the other side.
So let's go on to the next piece, which is how MITSS arrived in your life. So you did get together with Rick Van Pelt, who was the anesthesiologist.
We talked 6 months later. It was a great conversation, and then
He actually said it was the best conversation he had ever had in his life, right?
Yeah, he says that. And for me, it was wonderful. Think about it. I heard the truth for the first time.
So he told you all the details of what had happened.
Yeah, and I didn't really need them as much because I already knew, figured out what happened. I worked in an OR. I had access to other anesthesiologists to ask them, so that wasn't even a question, but it was nice to have somebody tell me, But actually, how it happened is I had been doing a lot of research on the internet looking for support services. There were lots of patient safety organizations. There were lots of patient advocacy organizations, and they used the word victim a lot. And for me, personally, that word victim, I just felt like that word sometimes can keep people stuck. And I didn't think I was a victim of medical error. I think there was a broader span. So there's error, and then there's adverse medical events or unanticipated outcomes, even in the best of circumstances. But the emotional impact's still the same on the staff, on the patients and families. So,
but you were also a victim of this whole culture of the way hospitals operate, and at that time, we're not telling patients what was happening.
And I was very naive to that. I knew they lied to me, but I didn't get the bigger issue. And so think about it. I'm a housewife raising my 3 children, looking for what she wants to do when her kids grow up. This event happens, and now I have a purpose. There's a sense of responsibility that I really can't explain. There's this hole in the system, and I know it's there, and shame on me if I don't do anything. I felt I had to do this. It was almost like I didn't have a choice. But I had a wonderful group of friends that really supported me, saying, you can do this, you can do this. Well, there's no support. Maybe you should start. It just evolved. Around that time, I got a letter from Dr. Van Pelt. We met face-to-face. Think about it. He and I didn't even know what one another looked like, but yet we had been through this really horrific event that was so impactful to both of us. So, and within a couple of months, I had a good friend that really coached me through a lot of how to bring a bunch of people together, to have a brainstorming brunch. Dr. Van Pelt was invited. Okay, we're going to start this organization. What does it look like? What do we name it? What do we, what's the mission? So there were about 20-something people in the room. We came up with, those goals. And then I had a friend that was an attorney, and we were incorporated in June 2002. But then, as an organization, we found out we had to get involved in the disclosure and apology movement. And really, how can you get to the emotional support if you're not acknowledging that things go wrong? And you have to have those conversations. So it was a lot of years of just having people listen, build credibility. And now it's more about letting people know we're a resource. We still do a lot of education and awareness, but we're a resource. We have direct services. And
do you want to say a little something about what direct services you have?
We have patient and family therapeutic support groups. We have identified themes that come up. So it's a 10-week curriculum. It's therapy, but it's support, but it's an educational piece too. We help them to identify what the emotions are that they're going through. And I think for me that would have been key, because I thought I was going crazy at some points because I was so alone in my thoughts.
So when would be an appropriate time for patients and families to get involved in a group?
I think that's up to them. What we've seen is so usually family members are really at impact very angry. They're kind of dealing with that, but they're dealing with the emotions at hand. So the patients and families, there's a delayed reaction in when their emotions hit. So I think it's going to be an assessment. We do an assessment. We have nursing groups. We help organizations to build infrastructures around supporting their clinicians, because I think that's equally as important.
Yeah. So it's just a wonderful organization, and it's something that I've known about for a few years. So I'm just delighted that you've been able to come and speak to us.
Well, thank you so much for having me.